Hey everyone, in this video we want to talk to you a little bit about metabolically healthy obesity because there is this perpetual belief in existence that, this subset of individuals who are obese and yet metabolically healthy kind of indicates that, obesity itself is not a health risk factor.
And what does it mean by metabolically healthy obese?
Well, it would be like, so this person's obviously obese based on their body composition, right? But maybe they have normal blood lipids, normal blood glucose, normal blood pressure. Like you can't, based on standard metabolic tests, you can't really identify anything that's wrong with them. Now, I mean, that logic alone is flawed because like out of all of the things in your body that could be affected from carrying around excess amounts of fat tissue, standard metabolic tests is like a really good part of it, but it's not everything. So already we just have a lack of information on all the things that obesity affects.
Usually it doesn't really show things until shit's gone way sideways.
Yeah, and that's actually.
And you don't want to correct a problem after the fact. Like you want to be preventative. That's where it's at.
Yeah, exactly. Let's use joints as an example, right? This isn't metabolic health. Let's just talk about joints. If you're carrying around excess fat, you're putting a lot of load on your joints that's going to cause damage over time. But, that's not going to show up in your blood work. And what, you're just going to say, hey, my weight's not a problem until you blow out a knee or give yourself premature osteoarthritis. Like that logic.
The logic is not.
It doesn't make sense.
There.
But let's stay focused on metabolic health specifically, since that's what they like to do, right? The entire reason that they're quote unquote healthy, metabolically healthy, is because they haven't passed their personal fat threshold. They imagine your fat cells are like a balloon that fills with air, right? Everyone has, based on genetics, environment, their food choices, their lifestyle, all of that affects their fat cell metabolism. That lets their fat cells expand when they take in too many calories. And it determines at which point fat cells cannot expand anymore. So the fat cells shut themselves off from outside energy sources. That's when they become insulin resistant and inflammatory. And, because the alternative is that they keep expanding, but they would pop, and a dead fat cell is no help to anyone, right? So
I don't know, a lot of people would say a dead fat cell is a pretty good thing.
Yeah, but then all of that energy would back up in your bloodstream. It would back up in your bloodstream with no one to go. I mean, look, what's like the signifying characteristic of type 2 diabetes? It's high blood glucose, right?
Yeah.
And high blood lipids.
Yeah.
And people are like, oh my God, your blood glucose is spiking up. You're doing yourself damage, by eating carbs, blah, blah, blah. And it's like, okay, well, if like that
what
energy.
What about your blood fat level too? Everyone dismisses that part, right?
Yes, pancreatic damage in diabetes, retina damage, nerve damage and neuropathy all come because glucose and fat backs up into the blood. Why? Because it's no longer able to adequately be stored away safely in fat tissue because these people have surpassed their personal fat threshold.
Yeah, and that's why you see skinny people that have these conditions of high blood lipids and high blood sugar.
Exactly.
Right? It's because they passed their
sooner than other people would. Yeah, it's a spectrum, right? Certain people have a low threshold.
It's the genetic lottery, right? You can't choose.
Part of it. And that's a huge part of it.
And so it's really, the way I look at this whole thing is you're playing like Russian roulette, right?
Yeah.
Like it's only a matter of time before you're going to surpass it. No one has like an infinite capability of storing that shit.
Here's the thing. People assume, hey, if I'm obese and metabolically healthy, that's just where I'm going to be at. And what I say is, right, but you're still engaging in the habits that made you at that body weight to begin with, which means logically you're just going to keep gaining weight. Like you're not just going to sit there where you're at currently because you're still doing these habits. You're going to keep gaining weight, and at some point you're going to pass your threshold and metabolic dysfunction is going to occur.
Exactly. So,
and we have studies showing that 50% of people over a 3 to 5 year period who are metabolically healthy obesity at baseline develop metabolic diseases over the next 3 to 5 years. Half of them do.
Because those habits that
cause them to gain weight persist, and
yep,
so they continue
don't just
to
go
gain
away.
weight. Yeah, so they continue to gain weight. So, and we also have studies showing that, I mean, even if you're metabolically healthy obesity, it still increases your risk relative to a normal weight for developing cardiovascular disease, subclinical atherosclerosis, kidney disease, type 2 diabetes, and non-alcoholic fatty liver disease. So, I mean, yes, metabolically healthy obesity is a thing. It is a horrible, horrible reason to believe that you're safe from metabolic disease, or that there are no risks inherent to obesity, because there are. And the inherent risks aren't metabolic, no, but they're structural. They're things like your joints, and they're things like your cognitive function and your mental health.
Oh, I just think about their liver being
hammered all the time. Well, and the liver being hammered is going to come when they pass their threshold. And fat needs to be emergency stored.
Oh, no, I was talking about like just the amount of food to maintain that kind of weight. Like you're just like hammering your liver constantly, and it can't detoxify, I know, anything from the environment.
Yeah, well,
that's what I was saying.
Yeah, well, I think that's a great point too. So again, we cover all of this information, references throughout about metabolically healthy obesity in the introductory lesson of the Fat Loss Blueprint program. And we do that because we want people to understand that there's a lot of false beliefs out there around being overweight or obese, and that obtaining a healthy body composition rich in, muscle tissue and low in fat is going to be the best bet for long-term health. And so if you're interested in that, you can get the program at alexleaf.com/fat loss blueprint, and, let us know what you think. But as for this video, thank you for listening. I hope you enjoyed the information, because that's what we're trying to do. And if you know someone who you think this information would benefit, maybe they're just constantly telling you about how their weight isn't a problem because their blood labs look fine, share this video with them.
Yeah.
Thanks.
Okay.